Hi everyone, thank you so much for joining another Lead Squared webinar. Today we have someone very special with us to take us through the session, and as always we have Chantel from Lead Squared. Now, before I move on to the speakers, a little bit about the topic today. So this is a healthcare special. We are trying to understand the patient journey, a step towards great patient experience. Let me just take you through some of the things we are looking to cover in this session. We will be talking about, the benefits of patient journey mapping, how to create a patient journey map, some of the strategies, and overall talk about improving the experience altogether. Okay, so let me come back to our key speaker for the day, who is Dr. Uzo. He is the Chief Medical Officer at Zuri Health. So he has helped facilities revamping their operational processes and improving the organizational performance outcomes, and he just brings a vast amount of experience from him. So lots to learn from him. To take us through the session and to moderate another wonderful session yet again is Chantel, who is the VP of Africa Sales here at Lead Squared, and so I've worked with Chantal for 3 years now. I have learned so much from her in these 3 years. Not just here, she not only does she have experience when it comes to healthcare, she also has a vast amount of knowledge when it comes to financial services. But let's just get to the guests now. So I'll hand it over to you now, Chantel. Dr. Uzo, please take it away. Lots to learn from you now.
Thanks, Shabani. And Dr. Uzo, thank you so much for joining us today. I'm so excited that we get to spend some time with you today. And thank you to our wonderful audience for making the time to join us. And I'm sure many of you are getting ready to put your feet up and relax with your family and friends over the holiday season. And we are in the last stretch now. And as we close out on 2022, we have definitely observed, certainly from a Lead Squared aspect, that many healthcare organizations are focusing on improving patient experience overall. And it seems that, this is certainly a trend that will continue into 2023. And, we can see organizations experimenting with different kinds of technology to execute and deliver on their solutions. Now, even if we look at some of the reports from HIMSS as an example, 80% of healthcare providers are willing to invest more into new technologies today and digital solutions rather than traditional methods. And I think this is really good news for the healthcare industry, because the traditional patient experience has been focused on a handful of touch points, which severely impacts the patient's experience and the healthcare provider's bottom line. So, Dr. Uzo, I'd like to ask you, what are your thoughts on these trends and the changes the healthcare industry has gone through over the last few years?
Thanks so much, Chantel. So I think the trend has been quite good. There's been a lot of focus, obviously driven partly by COVID. There's been a lot of investments, follow-on funding into healthcare, and which is good and ultimately beneficial for the patients, as well as the providers of these services. One thing, obviously, that we know is that there's been a lot of focus now more on the customer journey and the patient journey as well. This is something that has benefited other sectors, and obviously healthcare is not an exception on that. We've seen a lot of improvement in, the banking sectors, the restaurants, hotel services, and these are just other examples of sectors that have focused on and being obsessed about the consumer. And so I believe that, with all these efforts and trends and the customer being more aware, it's going to end up benefiting the patient at the end of the day.
Yeah. I think I absolutely agree with you. And I mean, like you said, you mentioned the term customer journeys. I mean, I think that's something that most of us are familiar with. And just in healthcare, we call it patient journeys. But so, you know, in your role as Chief Medical Officer at Zuri Health, I'm sure that patient journey mapping is something that you are part of on a regular basis. So how, like, what are the different kinds of stages that you take into account when it comes to, you know, putting together a patient journey?
Yeah, so we're very much obsessed about the patient journey because for us we believe in healthcare being provided at one's convenience. Again, many people are familiar with customer journey, but in healthcare we refer to this as patient journey. And one thing that is important is, I mean, to look at patient journey as the entire sequence of events from when a patient would like to access care, right? So it begins way before the patient actually visits the facility or engages with the healthcare provider, and ends way much after that, So it's basically an end-to-end journey, as it were, as said, and allows one to actually look at the entire process end to end and improve on the various touch points, which could be virtual, which could be physical, and provide the necessary outcomes.
Yeah. So, I mean, I think that's yeah, great feedback for all of us. I think, Dr. Izu, you'll know that I'm a great fan of technology and tools, to do things more efficiently. But when it comes to patient journey mapping, I always advise, customers that I work with to understand what your journey looks like today. Before we just jump into improvements, but doing this, understanding what their journey looks like today, puts you into a position where you can understand the gaps in the current patient journey, which gives you the opportunity to start identifying the types of interventions that will make an impact, to the overall patient's experience now. And not only that, but also give you a good idea of what changes you are actually able to make. Sometimes there's regulations, etc., and other factors that you've got to consider before just, making changes. And again, we spoke about customer journeys in other industries and patient journeys in healthcare. When it comes to communication, this is something, that we've seen raised in most conversations, where healthcare organizations are looking for assistance with regards to improving patient experience. But communication is essential in terms of doctors understanding patients' health, exchanging information about the patient and coordinating care for patients can become a challenge for a doctor because they don't have enough tools available to see this communication flow between each other. And this is not only a frustration for doctors, but it causes high levels of frustrations for patients. And usually it's as a result of there being a misalignment because they don't have the right technology in place, or the technology they have in place doesn't communicate with each other. So I think it's really imperative that there's always alignment between healthcare practitioners so that patients' information can be shared confidentially. And one thing to remember is that, I don't think it's possible to be able to manage your patient journey on an Excel spreadsheet. Healthcare is complex, and it definitely becomes necessary to automate certain components of your patient journey. So, like, in your experience, working with patient journeys and improving them on an ongoing basis, how can automation be achieved using technology?
So thanks. So yeah, clearly healthcare, like you rightly said, is very complex. We've seen a lot of adoption of technology within healthcare, which is very good. Not only from the point of view of health techs coming in to sort of try to see how to disrupt or improve, as it were, this kind of services that is being offered by the traditional healthcare providers. Um, but again, like I keep saying, like I try to say, the technology can, should only make things be done better. Um, yes, there are many ways in which certain providers have tried in the past to improve their services and the patient journeys, as it were. But down to things like using technology tools or automation tools, for instance, with appointment bookings, right? I mean, it looks like an easy thing. It looks like something that in the past, people had used diaries, calendars. But now, with technology, again, as things become more complex, it's easier to, automate these services to have like appointment bookings, reminders. I mean, who wouldn't love to have a notification pop up to say, I need to see a doctor on so day? It's something that, one can get carried away and forget. But it's a little detail. It actually adds that magical touch to one services and makes people actually get sold out. Or even my medication reminders for the chronic patients. Think about it. Someone who is diabetic and has to he's diabetic, hypertensive, and has to take so many medications. Having that ability to get reminded on a particular day that you've not taken your medications, or you're running out of medication and you need to actually plan for a refill and go to the hospital. Or follow-up scheduling. I've had the surgery. Um, or a woman has had a baby and needs to be reminded of when the vaccination is due. Who is a working class mom who is very busy. These are some of the things that technology can help to automate for us, and even collecting feedback. I mean, like I say, feedback is always good, even if it's not as pleasant as it is. But one who tries to use all these things to get all the feedback is able to then innovate or improve upon one service offerings. So basically, I mean, there's a whole, it's quite unlimited in terms of the services that one can, improve upon through, using technology and automation tools as well.
No, I absolutely agree with you. And I think beyond that, healthcare workers have been under so much pressure over especially during the COVID period. But often it's we forget the benefits in terms of how automation can actually improve working conditions for healthcare workers within your organization as well, because it takes away so much of this, repetitive manual work that needs to be fulfilled. And yeah, automation, like you've just rightfully mentioned, when it comes to your patient journey mapping, you mentioned earlier, that sequence of events. So I guess when you start your patient journey mapping exercise, you need to be able to include when and how, patients actually interact with your facility and their experience. So, and you need to do this for every stage of your patient journey. Like you mentioned, the pre-visit, the visit, treatment, these are all stages that need to be considered. And then it becomes a little bit more complex, because you've also got to consider the patient's emotional state at that stage. So it's important to remember that the patient's journey represents, that entire sequence of touch points, that a patient experiences within a given health system, facility, or with a specific provider. And whether these touch points are face-to-face, or virtual. I mean, it could be something like you mentioned, appointment scheduling, to reviewing post-surgery feedback, with your doctor. But the crux is that healthcare providers need to understand the patient journey extends beyond just those human to human interactions at a treatment facility or in a virtual consultation. And so what I'm trying to say is that patient journey happens before, during, and after a healthcare visit, at a very high level. So as an expert in healthcare, Dr. Uzo, I mean, what would you say? I mean, if we had to just take a high level, like an example of what a patient journey looks like, what would you say makes up a patient journey? I mean, are there some key stages you would look at?
Yeah. So clearly, I mean, the patient journey is quite vast, and I would say even for physical facilities, this actually begins. I mean, I don't think there's always a virtual aspect now of the patient journey. There's the pre-visit, obviously, patient journey, as as opposed to the patient experience, which essentially is more or less limited to the quality of care that one receives. The patient journey actually is much wider than that. So it starts with the pre-visit, right? So when even the person has a symptom, and then now when the digital age, and so if a patient has a symptom, patient discovers I have a rash, or I have a swelling, or I have this symptom, I would like to get care. That is where the patient journey actually begins. That's part of the pre-visit stage, right? And then the next thing the patient wants to find out is, okay, so who do I go to for this? And it is at this point that the healthcare provider needs to position itself to be able to capture value and address some of these things, right? The next thing the person may go on to Google, look for the nearest hospital. So one may need to ask, am I visible in that sense? Because now the patient is still virtual and hasn't even yet arrived at the facility. And then do I need to schedule an appointment with a specialist? What days do your specialists come in? I mean, these are some aspects that sometimes many healthcare providers tend to ignore and is actually very relevant, right? Putting together all those things.
And would you, on that point, so, just to jump in there quickly, I mean, you said a lot of healthcare providers tend to ignore, but I mean, from your perspective, do you think that there's still a big gap there in terms of healthcare providers having to catch up to be able to fulfill, or, I mean,
yes, absolutely. Absolutely. There's a huge gap. I mean, again, it starts from being aware of these things, and knowing that, okay, these are areas where one can improve upon and, use technological solutions or software to actually address some of these gaps. Once being aware that, okay, this is where the patient journey actually starts from, and then the patient is at the moment looking for what facility to use, or what where to get the services from, there's an opportunity there to position oneself, even down to finding the right hospital, the right, getting the right schedule, fixing an appointment. How, they are very, very. So in my experience, it was a big game changer in one of the facilities that I had worked with. This thing of just implementing appointment schedules. We had so much. I mean, the volume of patients coming in was so much, which is very typical in Africa, where you have fewer hospitals and fewer healthcare providers to the population. And then just something as little as putting together a schedule, whereby people come in at, regular times, allow the physician to pace himself and also allow the patients to be happy. And so these are very, very little tools or very little tweaks, as it were, that can actually make a lot of improvement. Then also arriving at the facility, right, or getting to access the service. So you get to the website, if it's a health tech, or you get to the platform, which many hospitals now have or healthcare providers have. And then you're confused. Where do I go to? Okay, is this the facility? Where's the sign? Where do I check in? Where, now this is now having to do with the patient journey at the facility or at the point of care. Who is there at the front desk? How do I know who to approach? Where do I wait? Where does my family wait if they accompany me? So it shouldn't only always be about the patient journey. Also even includes the loved ones and the family members of the patient, because they are also potential patients tomorrow, and depending on how well their ward or their relative is treated, they may end up, they could be repeat customers. Then there's also the post visit, which is almost many a times negligent or absent or not even there at all. Where the
Yes, I was going to say, or absent completely. Yes.
yeah, so patients having access care at the hospital, even down to little things like flowers, get well cards, follow-up visit, follow-up reminders. These are so many things that one can add to the patient journey and really make it a huge success. And even sometimes house calls, right? Where necessary, or messages, and just following up with that patient. It's like I said. I mean, I have seen it happen a lot. There are hospitals, there are healthcare providers who are really literally obsessed about this, and you have facilities where people are born there, they have their kids there, and they have their like it's a whole ecosystem for them because they have really taken good care of this whole patient journey mapping.
Yeah, I
And this
guess
is
at
just
the
a
end of the
simple
day,
example I've provided. I mean, this is not, I mean, it goes way beyond all of this. This is just a simple example that, that one can easily relate to.
thank you, Dr. Uzo. And I think, these stages that you mentioned, like the pre-visit, the during visit, the post-visit, and, thanks. I just wanted a high-level example, to put it into perspective. But ultimately, you went on to also talk about, like, that extended care, once, post a visit. But once you string all of these touch points together, essentially, this is a good example of what a patient journey map would look like. And this will now give you the opportunity to identify where in your patient journey you're actually delivering a good experience and where you're delivering a not so good or negative experience. And I think the next important point is that this is not, patient journey mapping is not something that one person in a healthcare organization can do in isolation. And I think the good news is that we actually see this happening, on the ground, working with healthcare organizations, is that there are many stakeholders that need to be involved when it comes to patient journey mapping. And not just stakeholders, but also considerations around existing systems, like electronic health record systems, hospital management systems, that come into the mix. And this is such an important point to discuss because this healthcare ecosystem is complex, and it involves multiple stakeholders that basically are all elements that come together, that will ultimately help you improve the patient experience. And if you don't bring the right stakeholders, into the patient journey mapping exercise, you may just get or end up with passing an existing problem further down into, along into that process. So when I talk about stakeholders, I'm talking about people that are delivering care, people that are helping booking with appointments, doing admissions. These are all stakeholders performing different roles. And even the doctors, the specialists that are delivering the care to pharmacies and nurses. But, Dr. Uzo, what's your view when it comes to including stakeholders and systems into the patient journey mapping exercise? Is it as big a deal as I'm making it out to be?
Oh, absolutely. I mean, it is very much a big deal because I mean the healthcare experience is very much a patient-centered one. Um, people would always be, you have like, people very much important. You have, the people, of course, the patients are very, very at the center of this. You have also the clinical staff and even the non-clinical staff within the healthcare organization. I mean, there has to be, everyone has to see themselves as, I mean, it's a strategic thing, and the organization has to have someone who is driving that. Obviously, I try to describe the head of the organization or the CEO as the chief patient experience or patient journey person. who has to be the one championing this exercise. Um, so that every aspect from the gates, and even from the website, from the person who is designing the website knows that we're focused about, getting a good patient journey right. The nurses, the care coordinators, the surgeon, the aftercare, the social workers, everyone is really involved. Down even down to the janitors, everyone in the hospital or the healthcare organization is really involved in driving this. Um, and obviously the place, one needs to also know, these are stakeholders, right? The place. So am I fully virtual, or am I hybrid, or am I physical, right? These days we're seeing, traditional healthcare providers begin to offer telemed solutions, or begin to offer virtual aftercare support, over Zoom and all those kind of things. So how do I try to build around these platforms or these spaces, to create a nice experience for my patients? How do I leverage technology? Obviously, technology is what makes it a lot easier these days. How do I leverage technological solutions to bring about a good patient experience for my stakeholders? So it's really very much important to keep that in mind. Again, like I said, it's something strategic, and the more you're going to see that the more healthcare organizations become more patient centered, the greater they win, right? The better. I mean, these are the ones that will eventually win in the future as healthcare begins to evolve. We are now seeing, I wouldn't say more patients are becoming more sophisticated, but the experience that they begin to get from other areas of their lives, they begin to want to demand that from their healthcare organizations, right? They've seen how it is, they've seen how seamless it is to make payments, with the whole digitization of banks and all that. They've seen how easy it is to order food online. They've seen how easy to order anything. So they're going to begin to expect all of that. And even if they don't, the big companies, who are obsessed about the customer and the patient, are already beginning to look for their own share of the pie of healthcare, and are beginning to want to go into healthcare. So again, the more patient-centered one organization is, the more they will get to win in the future. And I think this is a good time and space to be in right now as a healthcare provider.
Yes, absolutely. I mean, how it's evidence in so many studies, that patients, consumers, just in general, want convenience and easy access to healthcare. And like you said, why is it so hard, in comparison to ordering food? So lots of opportunity, and the guys that are in the front, the front runners, and taking advantage of the technology to help you bring to life, ultimately this patient journey map, are the guys that are going to win. So, following on from your last comment, I guess once you've got your patient journey mapped, and you've chosen the right technology, right, where you can configure these patient journeys, because elements of it naturally are going to be automated, the best place to start is to switch it on and start. And, from what we see, you'll quickly start identifying gaps, where there are potential pain points in your patient journey, so you'll know where to make improvements. Now, by getting a better understanding of the patient's pain points, you'll continuously be building. And when I say you, I mean that the entire stakeholder team will continuously start evolving into a very patient-focused mindset, so that you can start discussing and motivating patient-centric thinking, into your patient journeys. And as your patient's engagement levels increase, you'll start uncovering unmet patient needs, so that you can identify, these areas that you're falling short in. So it's continuous micro improvements that you're making throughout this journey. And very importantly, you will start being able to create strategic alignment between departments that will ultimately help you work together towards a better patient experience. And I think that just to add on to your point you made earlier around the people, I think you mentioned places and the tech. Now, so we've got patient journey mapping. We've spoken about technology and bringing in the people from an alignment perspective, but a big question is, and I'm sure that healthcare organizations want to know as well, how does patient journey mapping actually help your bottom line?
Yeah, so
Sorry, I'm
that's
putting you on
absolutely, yeah, it's a very good one. I mean, clearly, obviously, if I mean that's really important. If it's not just about offering. I mean, again, people think it works like magic, right? So the more you invest in building, giving the right patient experience, providing the right patient experience, it improves your revenue, it reduces your cost of acquisition of a new patient, it improves the lifetime value that you can extract from a patient. So I had just given an example of imagine a hospital where I was born, I get vaccinated all through there, my family gets a good experience, I grow as an adult, I continue to use that hospital, I bring in my family, and we continue to use that healthcare organization, and we continue to go on and on and on. That makes it, that obviously, if you look at it from the standpoint of the value that they have been able to extract from me, that's really immense. Again, the cost of acquisition. I mean, hospitals, depending on the locality and the regulation in many countries, are unable to advertise. And by just having a very fantastic patient journey or patient journey map and good patient experience, they are able to, they don't need to then advertise because they'll easily get referrals. Their net promoter score is going to be high. They're going to have lots of people recommending them, reviews, and then just generally improving efficiencies. So one key thing that happens again, hospital is. I had a friend who used to say it's an architect who said the hospital is the most complex thing to design and to really put processes around after an airport. And he wasn't, thinking about it later on, I realized that he wasn't wrong. One of the things that could happen a lot of times, so just think of it in an airport, you have arrivals, departure, luggage moving left and right, flights are being announced. I mean, that's how busy a hospital can get. And many times when it gets that busy, there tends to be lots of inefficiencies across departments. We all know, how, over time hospitals or healthcare organizations have evolved to put in place certain processes to improve all this. So the inefficiencies are reduced. The cost, the marketing spend, as it were, if that were to be described, is reduced. The cost of patient acquisition drops. People would then refer. People are then sold out, and then
And that's a big referrals is a big channel of business for healthcare providers in hospitals, right?
absolutely, yes, it is. It's a big one, and and this is something that if you have investors, they want to see also because I mean you're now more and more a force for good in an area, and people, once you just ask, you're like a neighborhood, store that saves them at any time, and people just love to hear that. People begin to say, I'm proud of, that's my hospital, like that's my hospital, and so that's something that definitely improves the bottom line and ultimately profits. People, even for staff, people are happy at their jobs, they're happy doing what they do. They see the good that they are making, impact that they're making in the lives of others, and generally churn rates drops, so many things. It's just incredible the amount of opportunities. It's like a triple bottom line, from a profit, impact, and purpose as well.
Sure, and thank you for that. I mean, that makes sense, all around. And one of the things I just wanted to add on to was, you know, when people, you know, that element of this is my hospital, I'm proud, you know. Um, I attended a healthcare summit a couple of weeks back, and you know, one of the points that was raised was around like reviews and recommendations, and something that really stood out was that, you know, I think it was around 83% of consumers, you know, trust the recommendations of their friends and family, that they people that they know, and another, you know, 62% of consumers trust the recommendations and reviews they see online from people that they've never met in their life before. So it's a really big opportunity, like you're talking about, like a triple bottom line. So thanks for that. Now, I want to make sure that we leave some time for our audience to ask some questions, Dr. Uz. I'm sure they're going to want to ask you some questions. But before I do that, I want to ask you an important question. You know, like I said, we're coming to the last stretch of 2022 now, and before we wrap up and go into questions, what tips would you share to our audience today when it comes to improving patient experience and preparing for a better 2023?
Okay, so for me, I would say one is, to have it at the back. I mean, to have it as a strategic intent to really be obsessed about the patient, and to have, a clear patient journey map in the organization. If you don't have one, right? We need one. You need to sit beyond, to look beyond the patient just in the facility, and to look at what are the other touch points that could exist outside the patient arriving at my facility, right? How am I positioned elsewhere? How am I positioned on the web? How am I positioned virtually? How am I responding to the feedback and the trends in the space, in the healthcare space, and also generally in society? I think that's something that healthcare providers need to be aware of, and need to look beyond, not just assume that, I'm there and so therefore they're going to come because I'm the nearest hospital to them. No, these days, they could get care from somewhere else. You're not just competing with a local hospital or local healthcare organization nearby or clinic. You're competing with, you're even competing with Google, Amazon. You're competing with everyone if you can't provide a good patient experience. I would say, get people involved, get the patient, have your pulse on the patient, and the feedback. Have a system in place where you're able to get feedback from the patient before they leave, and even after they leave, whereby you can, engage with their data, or engage with them to get, certain insights from them as regards, things they think you can improve, things they would like to see, and try to see how you can implement some of that. I think, so again, one thing I enjoy doing is, as a healthcare person, is just to look beyond, healthcare, right? To look at other sectors, to look at, there's so many things that one is able to innovate upon within healthcare, just by looking at, online food orders, e-commerce. As a healthcare practitioner, I think it's important also, and someone who, has any C-suite or strategic involvement in the organization, to actually look beyond healthcare and to look elsewhere, to say, what are the things I can learn or I can borrow from other sectors and implement, and how can I apply technology in bringing about these quick wins. I think those are my few nuggets I would love to share.
Sure, I think those are some powerful nuggets, and you spoke about the patient feedback. Just to maybe add on to that, what we're also seeing is really, like, there's been a lot of focus on extending care. So how do you enable, let's call it off-site caregivers, with the right technology to to extend that care to patients if they are out in the field, you visiting them at home. And so that is something that we are seeing a lot of, and obviously enabling our customers to do. I mean, maybe just some of the tips that I'd like to add to your list, Dr. Uzo, is I think a good starting point is that document your current patient journey. It doesn't have to be on fancy tools. Write it down on a piece of paper, and then put yourself in your patient's shoes and test your journey. Combined with researching other industries like Dr. Uzo, has mentioned. So this will give you the opportunity to really identify the areas where you're delivering a painless experience, and you're also going to be able to understand very quickly where you're actually just creating more pain for the patients. So before you can really improve your patient journey, it's also really imperative to make sure, like going into 2023, that you have the right technology that gives you a 360-degree view of your patient. Because like Dr. Uzo mentioned, in the beginning of our conversation, is that this journey starts when somebody, develops some kind of symptom, has a rash, and decides, they're going to go online and start looking. So you want full visibility of this journey. And then, once you've created this single view of your patient, you need to be able to have access to this information in real time. And every division or department within your facility, whether they're clinical, non-clinical staff, they need to have the right information to be able to help the patient with the right outcome at the right time. And this is really vital because your patient's overall experience with your organization is an accumulation of interactions across different touch points and different departments. So really important that you bring in this concept of connecting all your teams. And so to identify the areas that need the most improvement, you need the tools that will bring to the surface, all these blind spots. And that is exactly what healthcare CRMs and platforms like LeadSquare's automation do for people in healthcare. And, there's no value in having data if you can't translate it into any kind of actionable strategy that's going to bridge the gap between the patients and the healthcare provider. So just to stress this point, you need to get into a position where your operational data and your experience data, that patient's experience data, is in one place. And my last tip that I would add before we just move on to some questions is that I would definitely make it a priority to implement digital front door to your organization. And this is basically a way where you can offer patients an omni-channel engagement option. You need to make it easy to access healthcare, like ordering food, as Dr. Uzo mentioned earlier. But at the same time, keep it simple for your internal healthcare practitioners and non-clinical staff and clinical staff to use. In the days of communicating with patients in a very siloed approach are gone. So having a digital front door means that all your patient communications and journeys happen in a central platform. And this will give you more options when it comes to automating patient engagement at scale. I mean, Dr. Uzo mentioned earlier, dealing with large volumes of patients coming in. It's all about making sure that you've got a scalable, repeatable process. But at the same time, go into 2023 with the intention of improving patients' experience in the right places, but also the experience for your healthcare workers on the ground. So I hope that the tips that we've shared with you give you some ideas. So I'm going to hand back over to our moderators and see if we've got any questions from the audience.
Hello, what an insightful discussion. I do see a lot of really nice comments coming in, so that's there. I don't see any questions at the moment, but yeah, definitely some very positive comments coming in. Oh, yeah, another one. Thank you, Dr. Uzan Chandel, for an insightful session. Glad I tuned in. So, yeah, the audience is speaking for themselves. And to everyone who has joined in, I hope you have spent a moment responding to our poll questions. We'd really like to know more from you. So if you haven't, please do that. We are a few minutes away from closing the session.
Dr. Uzo, I mean, is there anything else that you want to mention that you think could add value to the audience? Maybe that little bit screenshot today, they've given you some good comments, but is there anything else you want to add before we wrap up?
I think for me is like you said, I know on this platform you have I imagine very much you have hospitals, you have traditional, typical healthcare providers, and then you have, people who obviously are either interested in, virtual or telemed or virtual health solutions who are trying to disrupt and scale um, seamless healthcare experience to a wider audience. I think, like you said, is the digital front door aspect on just having being really obsessed about the consumer or about the patient, and not just look at it from how much I can get or extract from this patient's pocket, but really trying to provide value. I think we're actually evolving. Healthcare is actually evolving at a faster rate than we can imagine. I say this from the aspect of where I sit and how we see healthcare going over the next few years. Not just on the continent but globally. Um, there's definitely going to be with a lot of investment, a lot of focus and attention. There's going to be a lot of improvement and a lot of, great changes we're going to see. And I think it's important that we constantly keep looking at how do I improve, how do I engage the consumer. Even if I was a traditional hospital that now leverages technology to offer a hybrid of solutions, but how do I really engage with patients? And how do I keep offering what they want, and trying to give them what they want, or even sometimes what they don't know that they want, but actually they want that, even going one step ahead of them to say, okay, I think this is something that will be good, right? And like you said, how do I string all of these processes together such that it makes no sense if um, the virtual or the virtual solution doesn't connect with the physical solution. So, or if you have multiple facilities, each time I have to go to each facility, I have to say my number, or, I should just be able to, pop up my data. I don't have to fill in the same data all over again. So having that seamless experience, even for virtual to talk to the physical, is something that is very important.
No, it's
Absolutely.
a great point. Great point. So, I mean, just to add on to that, Dr. Uzo, I mean, if I had to literally list, the top, like the top problems that healthcare providers have wanted to solve, over the this last 12 months, has been, simplifying the patient intake process. So when I moved from a GP to a specialist, to an X-ray department, I don't have to keep filling in the same information. I mean, it's just crazy. Imagine you had to do that on Uber. We wouldn't use Uber as often as we do, right? So, and these are easy to solve things in healthcare. The other aspect is that communication. So once the GP, moves me over to a specialist, the GP doesn't get any feedback. So, it's closing that gap between, doctor to doctor communication. And we've been able to do that, really, really well. And then, for clients for patients that are diagnosed with, let's call it, I don't know, renal conditions, and they need to make lifestyle changes. So putting together these patient care programs, that are delivered at the right time, like you mentioned earlier, making sure patients are, getting their scripts renewed, seeing a nurse when they need to, taking the right medicine. All of these things are, you're able to solve them using automation. But the starting point is to understand what that journey looks like today. And what do you want it to look like once you've identified those pain points? So, from Dr. Uzo, from my side, I'd just really like to, say a really big thank you. I've thoroughly enjoyed just learning from you today, and thanks for taking the time out of your really busy schedule to share your advice with our audience today.
Yeah. And before we go into closing remarks, there is a question actually that came in. So the question reads, how does one mitigate roadblocks or any obstacles in a patient's journey? Dr. Who's that would be for you. Yeah.
Yeah, thanks. So I think, I mean, that's a good one. I mean, clearly the patient journey map, the purpose of having the map is to be able to actually identify roadblocks or obstacles or gaps, right? So I think the whole idea of putting together everything, like was mentioned, is to say, okay, where are the typical pain points? So when you come up with a patient's journey map, you might be expected to see pain points, right? You see inefficiencies in communication, you see gaps whereby there's no follow through and aftercare support. So how does one mitigate some of this? I think it's really about being open to seeing all those things and then constantly innovating around each area that there's a block, right? If there's a problem with if it's a problem that when my patients arrive at the patient journey, when they arrive at the clinic or the reception, they don't even know where to go. You discover that something as easy, and I've seen it in very few hospitals, I must say, where you have clear signs, just like you see at the airport. I mean, at the airport, they keep put there are tons and tons of signages, where the gate is, where this gate is. When you move some few meters ahead, you see another sign saying this is still the way to the gate. Even just something as little as that, you will be amazed at how, I mean, that could be a roadblock, right, for the patient to say, I'm so confused, this hospital is so large, how do I know where the labor ward is or the cancer ward is? I'm coming to see my relative. Just having those signages clearly labeled can actually reduce a pain point in the patient journey. So I think the map actually allows you to see this roadblocks or these pain points and allows you to actually, keep fixing them. And it's a continuous journey; it never really ends. It's something that continues on and on.
Thank you so much. I hope that answers your question. I think, yeah, with that we can conclude for the day today. Thank you so much, Dr. Uzo, for your time. And we've learned so much from you. I know there'll be people here who would like to connect with you. So I will take the liberty of sharing your LinkedIn profile while sharing the recording of this session. As always, Chantel, thanks so much for moderating another webinar for us today.
An absolute pleasure, and big thank you once again to you, Dr. Uzo. It's been a great session with you.
Thanks so much. Pleasure is mine. Always happy to work with the Lead Square team. Thank you.
Lovely.
Thank you. Thanks, Shabani.
Thank you.
Take care, everybody, and happy holidays.
Happy holidays.
Bye.
Okay, bye.